Hi, it's Evan Kirstel here with eViRa Health out of Boston. Delighted to chat with a couple of fascinating people today. Firstly, Irma Rastegayeva of eViRa Health. Hi, Irma.
Hi, Evan. Hi, Tim.
And our guest of honor is Tim Washburn, Chief Clinical Officer at Electronic Caregiver. Tim is, among many other distinguished things, a nurse of 25 years, a nursing leader, and a leader at Electronic Caregiver.
Good to see you. Thanks for having me.
So, Tim, you basically let us know that you've been doing telehealth and telemedicine before it became popular and well accepted with COVID. What lessons have you learned from your experience with it? Could you tell us more about your remote lab solutions?
Sure. So, it turns out that the telemedicine, telehealth, has really been around since the late 1800s. And actually, the Coast Guard used it to provide care via radio for those sick on ships. So it really isn't new. The awareness and awakening of it in this particular situation is new because need has really driven folks to do that. Some of the things we've learned is there's really a misunderstanding of what telehealth is. Telehealth is not just the episodic doctor gets on the phone and calls you. That is telemedicine, and it's good. It's really that replacement of the brick and mortar when it makes sense office visit. A lot of advantages to that. We've been doing telemonitoring ever since 2009. Telemonitoring is that ability to gather data remotely in a patient's normal home setting. What we've learned is that when you combine effective telemonitoring with a good system that engages patients with telemedicine, the ability to connect to doctors remotely or a care team remotely, what you end up with is a really cogent telehealth solution. So our company is not focused on the technology, though clearly you need technology as a platform. It's focused on understanding how you organize different pieces of the solution through a unified platform that can deliver that kind of care and connection between the patient and the provider. So we've learned it can be very effective, and we've just been doing it for a very long time. We've actually used some of this ourselves. We've given our equipment to all of our own employees so that we can do some telemonitoring, and then based on what they're getting for symptoms, specifically a temperature, if they're running a fever, the ability to connect them with our telemedicine provider, PocketMD.